In 2025, Part B premiums are set to increase to $185 from $174.70 for most people. Let's break down why this is happening and what you can do about it. So before we dive into the Part B costs for 2025, let's go ahead and do a quick reminder as to what does Part B cover. So two main examples that I have here for you is medically necessary and preventative. So that is on the medically necessary, that's going to be things like doctor visits, outpatient procedures, and some home health care. All right, so in addition to the medically necessary, we also have three preventatives. These are, first we have screenings. These are things like pap smears, colorectal screenings, mammograms, etc. We also have shots or vaccines. And last, we have annual wellness visits. We want to get you in every year to make sure that you're still doing well. All right, so now we know what Part B covers. Let's go ahead and talk about Medicare Part B costs in 2025. So first, as I mentioned earlier, the monthly premium for next year will be $185 for most folks. I'm going to talk in just a couple of minutes about those individuals that are higher income and how that plays into the $185 because they're going to pay more for that. Now, the annual deductible is $257. Now, the good news with this, as I mentioned, it's annual. You only have to pay that once a year. And last, the coinsurance. Now, as a reminder, with Medicare, if you're on a Medicare supplement or a Medicare Advantage plan, this doesn't necessarily apply to you. But if you are on original Medicare only, your red, white, and blue Medicare card, then Medicare generally pays 80% and you pay 20% the cost of all of your services. So your coinsurance here would be 20%. All right, so just a second ago, I referenced that the $185 monthly premium for Part B for 2025 is income dependent. So what I want to explain is kind of how this works. So you'll see here that the way that these plans, the way that Medicare works is your 2025 premium is based on your 2023 income. So they look 2 years back. So for example, on your tax return here, if you made $106,000 or less, $212,000 joint as a couple, you would pay the $185 that I referenced earlier. Now, let's say then you're in the next category. You would then pay $259 per month. From there, it continues to increase. $370, $480, $90. For some reason, we start adding the 90 cents in here. $591, $90. And then last is $628, $90. So you can see the more you make, the more you pay when it comes to your Part B premium. So let's say your income is $450,000 as an individual. Next year, you will pay $591.90 per month on Medicare Part B. All right, so why is this premium increasing by, at least $10 per month? Well, the factors that are driving up the Part B costs. Now, first and foremost is inflation. As you may know, we have another video where I talk about the cost of living increase and what we're seeing there. The COLA, which is the cost of living adjustment for individuals receiving Social Security benefits, is 2.5% for next year. So the Medicare Part B premium increase is greater than the COLA for next year. But that brings us to our second factor driving up costs, enrollment. There are a lot of people on Medicare. Some years there's more enrolling in Medicare, some years there's less. That definitely impacts it. Now the third would be economic factors. We have another video where we talk about this as well, but as you know, everything is costing more. Inflation has really driven up a lot of prices. So when it comes to medical expenses or anything else, inflation is driving a lot of this. And then last, kind of what I just referenced, is the healthcare costs. They're continued to rise, and as they do, that then drives these Part B premiums from $174 up to the $185. So I always get the question, what can I do about my Part B premium? And frankly, not much. But I will tell you that if you're really struggling to keep up with that 185, and from a budgetary perspective, things just aren't really making ends meet for you, there are some options that I do want to address briefly. So first is Medicare Savings Program. So this essentially is for Part A and Part B. It goes from everything from deductibles to copays to premiums. It essentially is going to make Medicare a little more affordable for the people who are eligible for this. And typically you're eligible for this if your income and all of your assets or your resources are below a certain point. You do need to be eligible for Medicare Part A for this program, but really from there, just call us if you have questions about this. It gets pretty complicated. All three of these do, but they're things that I feel that are important to mention. Now, next is the low-income subsidies. This is primarily Part D, which is the drug related. So for those of you that your income is under a certain level and you struggle to, afford all of your drugs, there are low-income subsidies available on the Part D side of things. And then last is the Medicaid and Medicare. And what I want to mention on these are two different types of plans. So first is the SNP, which is a special needs plan. So for those individuals that are eligible for Medicaid and Medicare, there are plans available for you that can help you to really limit your out-of-pocket costs and help you to cover your Part B premium, your drugs, a few other things like that. So those are the special needs plans, or SNP is what a lot of us call it. And then in addition to that is PACE, which is the Program of All-Inclusive Care for the Elderly. Really a lot of this is getting very complicated. So my recommendation here is just call us. If you need extra help or you're curious whether you're eligible for these assisting programs, just give us a call. We're here to help. I know how overwhelming this can all be. I know that it's an adjustment every year to see what your Part B premium will increase to, but I also know that the number of people that are eligible for help that actually receive help are not the same. So there's a lot of people out there that are eligible for help that are unaware of the fact that they are. So go ahead and give us a call and we'll see what we can do to help you today.